right? So what do clinical psychologists do? I'm sure a lot of you probably would have had a look on the internet or spoke to someone who might know someone who's a clinical psychologist or someone who's been an assistant psychologist, who's got some experience in the field. And this is some of the information that's on the BPS website. So there's a lot there that you can just go and have a read. And I would definitely recommend if you want to go and just really get an idea of what it is that clinical psychology is, if this is the field that you want to go into. So clinical psychology aims to reduce psychological distress and enhance psychological well-being. So clinical psychologists work with a wide range of difficulties, whether that's people with anxiety, depression, relationship problems with families and children, people with learning disabilities, physical health, serious mental illness, and the list just goes on and on, really. Clinical psychologists usually work as a part of a team, usually with medical professionals, social workers, and most clinical psychologists would work in the NHS. But there's lots of people who've got private practice or who work for a private practice or do private work. So there's lots of different opportunities other than just working for the NHS. Clinical psychologists work with individuals and groups. A lot of the work that we do is around assessment. So when people come to us, say referred from a GP, the GP would send a referral saying this person has got problems with anxiety. Can you please assess them and find out what therapy might be useful? So a lot of our work would be around assessment, finding out what the difficulties for that person are. And then formulation. Formulation is about making sense of what the difficulties of the person are. So, for example, someone might present with anxiety and panic attacks, and in our psychological assessment, we'll find out that that person had a history of sexual abuse or some traumatic thing happening to them. So we formulate, which is done in terms of using psychological theory and research, and just really making sense of what the person's problems are, and understanding of their childhood and their kind of wider group of friends and kind of psychosocial way of looking at the difficulties that the person has. And that is a big part of work of a clinical psychologist. And the formulation is not only shared with the client to help them understand what difficulties, why they have the difficulties that they do, but also with teams. So say if someone's on a ward and the staff are having a really hard time understanding why is the person having these difficulties, displaying these behaviors, it's working with teams and helping them to understand some of the difficulties that patients might have. And then from formulation, we go into intervention. So whether that is therapy, or whether that is working within a group, working with a family. There's lots of different ways in terms of intervention and therapy. And like I've mentioned, it's working with teams, consultation, so not necessarily working with the client themselves, but someone who's working with them, say a staff member would come to us and we would consult them with them around how to work with that individual. And supervision and management, and there is a lot more really that there is to working as a clinical psychologist. So there is a website there for you to have a look at if you wanted to read a little bit more about. So in terms of clinical psychology, how do we get on the training? How do we become a clinical psychologist? What I was hoping for when I was graduating was something that looked like this, quite an ideal, straightforward route. Get out of my undergrad degree, get on the training for 3 years, become a clinical psychologist, and just get on with my career. Unfortunately, the reality is a bit different, and there's lots of kind of hoops to jump through and lots of up and downs, as some of you already have experienced in looking for some experience. So what is it that you need to do to become a clinical psychologist? So you will need your undergrad degree, at least 2-1, or ideally a first. There are some courses that will accept a 2-2, but you will have to have a master's degree as well. So if you can, just try not to make it more difficult for yourself after you've graduated having to do a master's. And getting a good degree is really important because the competition is really fierce. So with your undergraduate degree, you then need your 3 years of on the doctorate course. It's really competitive getting on the course, and most courses request at least 12 months of some clinical experience before you can actually apply on the course. So this is just give you an idea of you know, how many people apply and how many people get on the course. Sorry, can you see? Okay. So this table, you can find it on the Clearinghouse website, which is the website where you can find all the information about all the courses that do clinical psychology doctorate. So you can see that over the last 3 years, the numbers have been going up. There's 3,857 people that applied in 2012, and there's 586 places. So it's about 15% of people that apply get on. So it's really difficult getting on. A lot of people apply several times to get on the course. So I think it's really important to know that before people decide this is what I want to do, just having a bit of a sense of reality, how things are really working and how difficult it's to get on. In terms of the application process, the applications is sent in each year in December, and you can apply for a maximum of 4 courses. So I applied, well, this year, this is my second year applying this time, so the second time I applied for local courses. So it was Lancaster, Liverpool, Manchester and Leeds. So you can choose anywhere in the country. It doesn't really matter where, you know, really where it is that you want to study. But each course have got different expectations from the applicant. So it's really important that you read about each course that you're applying for. What is it that they expect? What is the ethos of the course? Some of them might, you know, more fit with you more as a person. Some of them are not fit with you. So that's important as well in terms of what place you're applying for. In terms of the screening process, some courses do a screening test, which is stats, which is not very nice. So you won't get away from stats, unfortunately, after you graduate, if you do want to apply for the courses. So for example, Lancaster course does the stats test. So it's an hour of, you know, doing different stats questions. You can look it up on their website if you feel bored and want to do some stats practice for the future. Other courses don't do any stats tests, so they just shortlist people for interviews. And each course, again, is quite different in the interview day. So some courses got a full interview day that's filled with a clinical interview, a research interview with a service user panel. Some courses just have a half an hour interview, and that's all, you know, all the time that you have to really present yourself and the experience that you have. So getting the right experience, that's some of the questions that you've mentioned, or some of the things that you said that you want to get out of today. Getting the right experience is crucial, because having just an undergraduate degree clearly is not enough to get on the training. Starting with volunteer opportunities, I think, is really important, and a lot of people have to start with that before actually getting a paid posts. As an assistant psychologist, as a research assistant, all the list of jobs that are relevant jobs in terms of, you know, getting on the training. A lot of people would start with being a support worker, for example, working in a healthcare setting, or with people with learning disability, or working in a care home. And getting more clinical experience will then help you to get an assistant psychologist job, which that's the most kind of highly regarded jobs in terms of applying for the clinical training. But not everyone who's on the clinical training has been an assistant psychologist, so it's not a rule. But it's something that's certainly, you know, important to look into. This is just ideas for job hunting. Again, volunteer work is very important, whether you could be the Samaritans, being on whatever kind of call. Sorry, you can't really see, can you? You know, Childline. It could be working with children with autism or learning disabilities. There's lots of voluntary opportunities that would be relevant in terms of applying for the clinical training. And this is just a few websites for you to look at. The ClinSci website is really helpful actually in terms of looking at lots of information about the courses, about jobs, about interviews, about applying for assistant psychologist posts. There's a lot out there on that website, so it's really helpful in terms of getting experience. And this is just some helpful hints, like I mentioned, the ClinSci. There are assistant psychologist groups that run in lots of different areas. There is one in Liverpool. They do different talks. They have clinical psychologists come to them and talk about what area of work they're doing. People prepare for the stats test together, prepare for interviews. There's a lot of talk about voluntary experiences, so it's really worth getting in touch with them and seeing if you could come along as students. What's also really important is networking, and you talked about knowing the right people, and sometimes if you ring up and ask to speak to a clinical psychologist, very rarely is that you manage to speak to a clinical psychologist who will say, oh yeah, come along and shadow me doing therapy. And this is some of the things I've tried and they just didn't work. And sometimes it's getting in touch with people who are assistant psychologists who will have the time to talk to you about their work is it's the way to go, really. And again, going to different kind of trainings and seminars when you can meet people. If it could be people who are doing their PhD, research assistants, asking them about opportunities that that they might have in terms of helping with their research. There's a lot that you could do in terms of networking and getting to know people that might be quite helpful in terms of getting on the training or getting jobs. In terms of money, I'm sure we're all paid a lot of money for our degree, so we want to know how much money you're going to be making as a clinical psychologist. So you can look up all the banding. As a newly qualified clinical psychologist, the band 7's around £30,000, and again, with more experience, you can go into more kind of experienced, better paid roles. As an assistant psychologist, you're usually on band 4, which is around £17,000. So it's just getting an idea of how much you could be making in terms of getting out of the undergraduate course and the opportunities and pay there, really. In terms of getting more experience, other than getting clinical experience, and I'll talk a little bit more about that in a minute when I tell you a bit more about my route and the experience that, the route I took to get on the training. The other route is to, do some postgraduate study, which I think is important to do alongside getting your clinical experience, not just on its own, because often that is not enough. So you could do an MSc or an MPhil, which is Masters in Philosophy. The difference between the two is that MSc is more like an undergraduate program when you've got different modules. It could be an MSc in Clinical Psychology. I think there's one in Manchester, but there's lots of different ones. An MPhil is just a pure research degree. So like we'll be doing your dissertation, is just a year of when you just got one research project, which is around 25,000 words, and that's all you're working on. You don't have any teaching, any modules. You can do that in a year or 2 years part-time. But again, it's important to think about the cost. I think the cost right now is around £5,000, whether you want to invest in that. The MPhil is quite a demanding course. It's a lot of kind of independent work where you have to really be motivated, and especially if you're working at the same time, that could be quite difficult. And I think it's really important to look for opportunities to kind of present your research, whether that is would be an MSc or MPhil, and to publish. And that goes with your dissertation as well, actually. If you choose your dissertation, which I think is really important to do it in a clinical field, if that's what you want to do, then to look for opportunities to publish your work or to present your work at least. There's lots of different conferences you can go to, and you can submit your abstract, and then you could make your research into a poster. You could go present a poster, or you could go and present you know, a 15-minute to some students about what you've researched. And again, that's something you can put on your CV, on your application, on the clinical training, and that always is really helpful in terms of, you know, showing that there's a lot of, you know, you're being proactive and you're really being involved in the field. So I'll tell you a little bit more about my route into clinical psychology, but then this isn't in any way not the only route to get into it. There's on the training course, there's lots of people coming from a very different backgrounds. I graduated from John Moores. I took some time between going from college into my undergraduate degree, so I did a lot of volunteer work while I did that. I did some traveling and worked abroad. After that, when I started my degree here, throughout the 3 years, I was working as a support worker with people with learning disabilities, and that then counted towards my clinical experience when I was applying for jobs afterwards. So I think it's really important in terms of thinking, you know, you were asking about experience after university, but really it's important to think about what experience are you getting now while you're at university, whether that could be you know, one day or one afternoon working voluntarily somewhere, or working as a support worker, a care worker somewhere on a Saturday. It's getting that clinical experience that you will be able to, you know, when you graduate and then applying for jobs, it will really put you in a good stead of already having done some work in that field. I also completed the is it World of Work? So that was really helpful in terms of getting me to think about what is clinical psychology, what do clinical psychologists do, and really thinking about how would that fit with myself. Is it something that I would enjoy? I also did a job application and a mock interview here, which was really helpful in kind of more safe environment, having an interview where I was able to get some feedback before going out and having an interview. So I would definitely recommend when you're applying for jobs and you've got an interview coming up, or even if you not have an interview but just want that experience, it's really, I find that really helpful. After I graduated, there was an opportunity with one of the lecturers who was doing some research to do some research assistant work. So over the summer after I graduated, I was, well, before children broke up from school, I was going to schools and doing some assessments with children. So it was just bringing a laptop and doing some tests on the computer, putting it onto an Excel sheet and sending it back to the researchers who then analysed it and wrote up a paper. And that was really helpful in terms of, you know, being able to put that on your CV, as well as getting some experience in terms of liaising with schools, working with children. And I would definitely recommend that in terms of, you know, speak to people that you're doing your dissertation with when you have a project. Speak to people in your department. Is there any research opportunities over the summer? Is there anything that, you know, people are interviewing people for their research? Can I go out and interview? Can I go out and give out some questionnaires to people? Just any opportunity you can, really, in terms of, and I'm sure there'll be lots of people in your department who will be more than happy to say, yeah, I'd love for you to do some kind of legwork for me, which will be great for your experience. I've then begun to apply for assistant psychologist posts, and I managed to get a post in the Brain Injury Rehabilitation Trust, which is here in Liverpool. So I did some neuro work for a year, which was really, really interesting. So I worked with people post, you know, traumatic brain injury, and there was lots of different kind of, you know, things you can do as an assistant psychologist, lots of different opportunities. You can work with people in neuropsychology, similar to what I was talking about in terms of being a clinical psychologist, so many different kind of post that you can get. In terms of this post where I was in, I did lots of data collection work. So we had 30 patients in like an inpatient unit. We did lots of behavioural observation to look at our interventions and how effective they are. I also did some one-to-one sessions. I don't think I'd call them therapy at that time, but more sessions with service users and working within a multidisciplinary team in terms of, you know, looking at the overall care for the individuals, for the service users. After that post, I worked as an honorary assistant psychologist in Merseycare, and at that time a lot of the assistant psychologist posts were cut and it was just really difficult to find any paid posts. So I went to an honorary post a couple of times. I did a few days a week. And it really is about how much time you can give and whether you need to be working to get, obviously, finances. So I was working as a support worker as well as honorary assistant psychologist. And that involved working on a project with people with learning disabilities, looking at churches in our area and in terms of what provision they had for people with learning disability and how understandable churches for them. So that was really interesting. It was really different. It wasn't very clinical in terms of being with the individuals themselves, but maybe looking at more at provision for those people in that area. At the same time, I was also doing an MPhil, Masters in Philosophy and Clinical Psychology at the University of Manchester, which was, I did it over 2 years as a part-time program, and I was my thesis was looking at self-concept and self-esteem in children with autism and Williams syndrome. And that is something that I did that for 2 years, as well as working as an assistant psychologist and try to you know, find opportunities to present at conferences and still currently trying to publish as well, which was really helpful in terms of then applying for the clinical training. In 2012, it was the second time I applied for the doctorate training, and I managed to get 2 offers in Liverpool and Leeds, and obviously chose Liverpool. So that's in terms of, you know, my route of getting into clinical psychology. I'll tell you a bit more about training itself, but at this point, feel free to ask any questions, anything that kind of jumps out at you in terms of what is it that you would want to know about maybe your situation and what is it that you can do in terms of getting some experience. Is there any questions?
Do we understand what assistant psychologist is or how you know where to look?
Okay. Okay, sorry, I probably not explained that well. So assistant psychologist posts are mostly advertised on the NHS website. So you need to be have finished your undergraduate degree. So to be an assistant psychologist, you need to have finished your undergrad and you usually have some clinical or some experience in a clinical field, which could be being a support worker or working, you know, doing any of those jobs that I've mentioned before. So they're advertised on the NHS website, but a lot of the time they're really competitive, and sometimes people need to get an assistant psychologist post in a private organisation before working in the NHS, which I did, but not everyone, but they're really competitive. So you can also, the ClinSci website is a really good website for advertising assistant psychologist posts. There's a lot on there. And as an assistant psychologist, you can do a variety of things. You could work, like I did, in a brain injury unit. You could work in older hay with children, preparing them for surgery. You could be working with older adults in terms of, you know, people being diagnosed with dementia and doing assessment with them. So there's a lot of kind of neuropsychology work in terms of cognitive testing with people. There's forensic assistant psychologist posts. So there's, I think they're the kind of gold standard, I guess, for what clinical, you know, training courses want in terms of you applying. But the climate is changing because the jobs are not many. You know, the courses are looking at other experiences that are there, like a research assistant. In terms of being a research assistant, usually, again, you have to have been qualified or finished your undergraduate degree. A lot of the time, people do a master's before they apply for a research assistant post, but that's not a rule. And it's really helpful to have some kind of experience of doing some research. So like I said about, you know, working with someone in your field.
I was going to say that I've been like speaking to my lecturers, and I'm going to be working with one of them over the summer as research assistant.
Okay,
so
that's fantastic.
Like ask and like be a bit cheeky and get in.
Yeah, that's perfect. That's exactly what you need. You can then put that on your form. I've been working as a research assistant at the university in this field, you know, involved in data collection, involved in recruitment, or whatever that is that you'll be doing, which is then great when you're applying for posts like assistant psychologist or research assistant. Yeah, that's fantastic. Yeah. Okay. Is there any other questions in terms of getting experience, anything that jumps to mind?
I was going to ask, like, it's not to do with experience, but
okay, that's fine.
Which one's like better regarded, like MSc or MS Phil?
They're quite different. I think some people would say the MPhil is regarded more in terms of kind of academic work, because the MPhil, the reason why I did the MPhil is because it's your first step into doing a PhD. So my plan was that if I didn't manage to get on the doctorate, then I would carry on with my MPhil and do then a PhD, which is a really hard work. And after finishing the MPhil, I knew what wasn't for me. So academically, I think the MPhil is regarded, you know, as a little bit more than the MSc. But I think in terms of applying for the clinical training, I don't think there is a difference. And in terms of, you know, people scoring your applications when you apply for the clinical training, you know, you would get so many points for having a first, so many points for then having a master's, and maybe one more point for having a PhD. So I don't think there is a difference in terms of MSc and MPhil. And I think really it's about what would suit you. Would you know, a degree where you've got modules, when you've got essays and kind of deadlines, would be more suitable than a year of just working solidly on one project. It really is, yeah, it's up to the person what works best for you. Yeah. Okay. Is there anything else that you're thinking of about experience? Any questions in getting into posts? No? Okay.
Students look for support work, and where would you look for that normally, and what, perhaps it might be useful to explain more about what support work is?
Yeah, that's a good question. Support work, you can, in terms of looking for jobs, they're in the newspaper, they're, you know, so looking in your local newspaper, there'll be lots of jobs, working in a care home, working with people with learning disabilities. There is a lot out there, working with people with mental health problems. What support work would involve is, I worked as a support worker with people with learning disabilities in a residential unit. So what my work would involve is just coming in the morning, supporting them to, you know, get ready, to go to college or to go to work, supporting them in making their breakfast, getting them bath, getting them dressed, that kind of thing. And then maybe going to college with them, or going to work, supporting them in that kind of environment. Work would entail, you know, being somewhere for an hour, and you just go along with them. It really depends, a variety of things that you could be doing. And then coming back to the residential home and spending the evening with the service users that you're supporting, going shopping, going to the cinema. You could be working in a care home with, you know, with older people. You could be working at a school with for children with autism, where I worked in Southport. And there's lots of other, you know, kind of educational facilities in the area. You could be working as a teaching assistant you do need some experience for that, and I'm not entirely sure what that is at the moment, but you might look into doing that, even voluntarily going to work and supporting someone, say, with a learning disability. So that is an opportunity as well. And again, that's just jobs that would be in the local newspaper or on the internet. The health support workers, that is another job that you can look at on the NHS website. And I know a friend of mine did a post in the Neuro in Bolton as a healthcare assistant, and then got to know someone who was doing kind of assessment work, and then she worked there voluntarily as an assistant psychologist. So you can kind of be looking for those jobs and then have an opportunity to maybe get to know someone who would then give you a voluntary experience. Yeah. Okay. Okay. So I'll tell you a little bit more about the training, and then we can look at some more questions if you've got any. In terms of the training on the doctorate course, there's 3 main elements, and I think it was mentioned on the film before. The academic element is, in the first year we've got 2 days of lectures, and that involves, the academic side involves, you know, writing assignments, writing up clinical reports on the people that we work with in our clinical side. In terms of the clinical work we do, we've spent 3 days a week on placement. So the 3 years are divided into 6-month chunks. So the first 6 months we spend on a placement with in adult mental health, and then older adults, then learning disability, then child, and in the 3rd year we'd specialise in you know, whatever area that we want to go to. It could be forensic. There's training opportunities in Ashworth, and there's a lot that you could specialise in the end, which then doesn't mean that that's the area I need to go into after, that you specialise in, but it's all the different areas that you've trained in you can go into. Doesn't mean that you have to specialise and then work in that area. And then research, so similar to your dissertation, would have to do a big dissertation, about 25,000 words on a given topic that you usually come up with. And there is a smaller piece of research work as well. So that's about the training. It's a lot of hard work, but it's really rewarding, and it's quite nice to have a bit of a variety in terms of spending a few days in university, being with your cohort. It's 24 of us, so that's really nice in terms of getting a lot of support, and then going on to your training, and then being supervised by a clinical psychologist on the training as well, so which is great. And it's one of the things I'm just thinking I forgot to mention about supervision. So when you're working as an assistant psychologist, you are supervised by a clinical psychologist, which is then important in terms of getting references when you're applying for the clinical training. So, you know, your kind of ideal experience would be being supervised by a clinical psychologist who can then give you a reference when you're applying for the clinical training. Okay, so I've brought a couple books with me. Feel free to have a look at them. If you want to pass them around, maybe write down the reference if you want to. They're quite helpful in terms of reading a bit more about clinical psychology, how to get on the course, what experience you want to get, really how to get your foot in the door. So have you got any other questions, anything that you want to ask?
You know, after you finish the doctorate, what kind of, will you just like go in straight into a clinical psychologist job?
Yeah, so when you qualify, you then chartered clinical psychologist, and you could be applying for any clinical psychology job. So that would usually be in the NHS, it could be privately, but that's the end of your training, and then you're qualified to apply for jobs. Yeah. In terms of the jobs that are out there at the end, because the number of trainees are limited, because obviously you're being paid when you're training, when you're doing the doctorate. There's a limited number of funded places, so there's only a limited amount of people that qualify each year to get into clinical psychologist posts. So there are jobs out there, even though in the current climate it's probably not as many as there used to be, and they are shorter contracts. So where a few years ago someone would qualify, apply for a clinical psychologist job and get a permanent post, today a lot of the posts are for 12 months, for 24 months. But that's just across the NHS really. But yes, there is jobs out there at the end.
So it goes like you do, say the degree you do now, then you do some sort of like experience, and then you go and apply for a MSc or a MPhil, and then after that, I don't understand like where masters comes into it. Like,
Okay.
is that just a choice or? Like,
Yeah, it's a choice. So you don't need a master's at all, but it just helps when you're applying. So you finish your undergrad, and theoretically you could apply after that because you've academically you've got the experience that you need. You don't need a master's, but it just adds to your experience. So what the courses are looking for is for you having an undergraduate degree, 2-1 or a first, and then having experience, which is clinical and research as well. So your clinical experience would be, doing support work, get an assistant psychologist job, and on top of that, it's really helpful to have some research experience, which could be done in getting an MSc or getting an MPhil, but that's not a rule. It's not something that you need to get on the course. But some people do that to improve their chances of getting on the course. Yeah.
It's the course that you're on, that's doctorate level, isn't it?
Yes.
So that's like a professional doctorate.
Yes.
Sort of research degree.
Yes. Yeah, that's right.
So it's like higher up than a master's level.
Yeah, that's right. Yeah. So for some doctorate courses, you need a master's. For this one, you don't, but you need a lot of kind of prior experience to be able to kind of really do the clinical work on the doctorate training. Yeah.
I was looking at possibly going to New Zealand to do completely psychology, the doctorate.
Okay.
In clinical, and I know it's a sort of an equivalent entry level for getting work over there. Is there any, or would you think there any sort of subsequent training you have to do over there first?
Not looked into that, but I know some people who are thinking about maybe going to America or Canada, and the ClinSci website is usually good in where people kind of talk about what it is that you need. I know in America you need some additional exams. That's the same in Canada. I'm not sure about New Zealand. So it's definitely worth looking into it and kind of knowing what your options are, because I know some places in America are really difficult in terms of doing lots of exams and kind of proving that you have the experience, even though you've qualified here as a clinical psychologist, you've got your doctorate, and here you can just go and practice. But over there you need a lot of additional kind of exams and just kind of proving that you've got the qualifications that you say you have. Yeah.